All right, thank you so much for inviting me to talk a little bit about our work at the Medical College of Wisconsin and our P20 Exploratory Center. I always feel like when I talk here or at a recent Wash U Symposium, I feel like I need to just kind of announce that we are going to totally change the direction of what we're talking about. I am a clinician and a co-investigator in our P20 group, and we're really talking about clinical care delivery. I'm always so amazed and fascinated by all the basic science work that everyone presents at these meetings. And now we're really going to shift the focus on how we deliver this care that we're working to improve through all of your work in basic science and therapeutics, and really how can we actually then get that to our patients. So our focus today is going to be talking about our pilot of an electronic health record integrated clinical care pathway for women's urinary incontinence. We're going to focus on women's incontinence today. So I think everybody knows urinary incontinence is a very common problem. And if I can make everyone know anything, it's common, but it doesn't have to be normal. I like some of these funny memes on the internet, but unfortunately they normalize the problem, and I really don't like that. But it's a big problem. We know over 50% of women over 60 struggle with urinary incontinence of some kind, and it's a huge societal burden. It's a common reason for admission to nursing homes. It has an impact on mental health. It can lead to social isolation, which we know is associated with early death. It's a huge economic burden, up to nearly $1,000 a year per affected woman. For affected women, but we know that even though it's very common, not all women seek care. So this is some work from Erickson. This is the diagram is from the 2019 study where they looked at nurses in the nurse health study. So these are women with high health literacy, and looked at the number of these nurses who reported urinary incontinence, which was over 18,000 women. And looking at them, they looked at kind of how many of them had actually sought care for urinary incontinence. And in that study, 84% of them had actually not been treated, or at least not sought care for their urinary incontinence. And this work was recently updated a few months ago. It's supposed to be 2021. And they actually found that less than 7% of these patients had actually been evaluated for urinary incontinence symptoms. And it was actually the same in both nurses and average women, so with less health literacy. So maybe health literacy is not so important. So when we think about what are the barriers to urinary incontinence care delivery, I think it's important to kind of back up and figure out, well, how does one seek care for this problem? So really, a patient has to understand what's going on. They have to be aware of not only that they have these symptoms, but that this isn't just a normal part of aging. They have to be aware that there's actually treatment options. Otherwise, why would you seek care? And they actually have to desire treatment as well. Then there's the initial steps in treatment involving care-seeking behavior, either to a urologist, urogynecologist, or maybe a primary care physician. They have to have treatment that's accessible and to actually take part in that treatment, possibly a referral, and then, of course, subsequent treatment. So this is kind of the overarching care delivery schema. And really the focus of our work, where we thought we could make a difference, is really in this initial steps in treatment, especially the initial appointments. So the work of our P20, and we call ourselves the TIGER Group, Translational Interdisciplinary Genitourinary Research Team, which is led by Catherine Flynn and Joan Nooner, and Dr. O'Connor and I are kind of the content experts as a female urologist, and I'm a urogynecologist, as well as Dr. Crotty, who's an informatics expert. And you'll see why we wanted an informatics person with us. And as the team has grown, we have included a variety of other experts as well. Dr. Hoganson, who's here today, Dr. Wynn, and Emily Schmidt is our wonderful study coordinator. So I'm just going to be really focusing on a couple of the aims of our P20 today. So it's just a few of them, but here they are. The first of all is to just routinely measure patient-reported urinary incontinence in a racially diverse population of adult women in primary care in our healthcare system here in Milwaukee. And our second aim is to really pilot test a guideline-based incontinence care pathway that integrates both primary and specialty care. So this looks really simple. This is kind of what our group came together to think about. How would we ideally want to deliver care in our health system for urinary incontinence? And this took so many minds coming together, and we're very grateful for the P20 funding our efforts to bring all of these minds to the table to bring up what we thought a good care delivery would be. And we're going to focus on a few of the sections of the treatment pathway today. So first of all, aim 1 is looking at this primary care screening, and aim 2 is actually how we can deliver treatment. So aim 1, again, this is a routine assessment of how patients are doing. And our focus, for multiple different reasons, which we'll get into, and then Joan will get into a little bit more tomorrow, is really focusing this on the Medicare annual wellness visit. So for those who are not clinicians, what is the annual wellness visit? So the annual wellness visit is recommended for all patients who are enrolled in Medicare, so 65 and up. And the goal of this annual visit is to proactively address their health by identifying modifiable health risks. If looking at their fall risks, are there rugs in their home that they can trip over? And the goal of this is to prevent any functional decline and to suggest behavioral changes that might improve patients' health. So is urinary incontinence part of what we do? Well, in some providers do assess for urinary incontinence, but it's not currently required, and there's no current American College of Physicians screening recommendation. However, this has been a quality metric for Medicare in the past, is really looking at an overall view of functional status assessment at this visit. So really, we thought that this would be a great opportunity to ask women about their urinary incontinence. So we developed a patient-reported outcomes single question PRO that patients could complete through the EMR. And after a lot of thinking about the best way to ask patients, we came up with this question that's a simple yes or no answer. During the past month, have you leaked urine, even a small amount, or worn a pad for urine leakage? And importantly, this is an EMR-based question. As a part of the annual wellness visit, patients are asked to answer a lot of questions, and we have built this into that list of questions that patients are supposed to fill out before they come to their annual wellness visit. Now, if patients don't answer those questions before they present, this can be put in by the provider. A simple yes or no answer. And more to come tomorrow. Joan is going to be presenting kind of more about how we're going to use this information to build a registry and talk about our collaborative efforts. So moving on to our aim 2, which is the pilot study of how we are going to test this guideline-based incontinence care pathway that integrates all of the care. So again, moving more to the right side of the screen of how we're actually going to deliver this care. So specifically, we're going to focus today on a tool in our electronic medical record, which is Epic, which is a very common, I think the biggest market share in electronic medical record systems in the country. So we all know, and this actually came up in the breakout session for my poster in the last session, was primary care providers are very busy, and there is a lot to talk about at the annual wellness visit. And so something that came up with all of our minds, specialists and primary care doctors and informaticists in our P20 meetings, is how can we make this simple? How can we not put a lot of burden on our primary care providers who have to address this laundry list in the annual wellness visit? How can we take that burden away from them? And what we developed is what's called a smart phrase in Epic, if anyone's familiar with that, which really some people call it a dot phrase. And all that a provider has to do is type .ui care in our system into a patient instructions area. And what that will automatically transform into is this short couple of sentences, which is saying that you told us that you leak urine, also called urinary incontinence. So giving a little education right off the bat. Your doctor wants you to know that there are self-treatments you can learn that reduce leaking for up to 85% of women. It refers to a website that's hosted by the Department of OBGYN, thank you to them, from the Medical College of Wisconsin for free information, low-cost classes, and a free smartphone app. Really, we are considering this a digital therapeutic. We are sending something to patients that they can digitally use to improve their quality of life and improve their health. So what does that website look like? So this is the actual screenshot of the website, again, hosted by my department in OBGYN. a little blurb at the top of the page saying why the patient has found this website, similar verbiage to what is in the UI Care smart phrase. And there's multiple different resources that are available now to the patients. First of all, we have the Tulip Project video, which is an evidence-based video that's actually focused on urinary incontinence prevention. We are actively building an urinary incontinence treatment video with very similar information, but with a slightly different focus, more about treatment. But we are using the Tulip Project bladder health class, which is a really, really excellent video and is evidence-based and linked here. We also are referring patients on the website to the Tat App, which is an evidence-based application for either for some kind of smartphone that is useful for doing pelvic floor muscle exercises, as well as education about lifestyle impacts, including physical activity and what patients drink on the impact on their urinary incontinence. Here's a couple of screenshots of that. And of course, we also had to refer as well to this wonderful program that Dr. Brown is very much involved with, which is funded by the Wisconsin Institute for Healthy Aging, which is Mind Over Matter, or the MOM program, which is a focus on both healthy bladder as well as healthy bowels. This is a wonderful resource with workshops that can be done either in community-based setting, in person, or there are also online classes that patients can find. So on the website, we actually link to this website, which is a screenshot of the website, but also directly a link to where patients can actually just go in and find and schedule a class close to them. We also have linked this brochure, again, with evidence-based medicine. This is through the PCORI Foundation, Healthy Women, and the National Association for Continence that have created this lovely PDF that doesn't look as lovely on my screen today, with just some information about non-surgical treatment for urinary incontinence. So again, today we've really been focusing on what resources are available to us, and the resource that we really wanted to focus on today is the resource that sometimes feels like a burden to us clinicians, which is our electronic medical record, but really knowing that we can harness that tool as well as these other evidence-based therapeutics, and just really trying to improve the way that we can deliver that care to patients through this digital therapeutic. You know, again, we have spent a lot of time thinking about how we're going to improve care delivery here at Froedtert and the Medical College of Wisconsin. And really, we are looking forward to in future Caribou meetings, and also tomorrow with Joan's talk, talking more about the outcomes as we are this week rolling out this care pathway. Thank you so much.